Hi Tanya, this is Cecile, and we're doing a video on the TMJ disorder right now, and this is Julie, my client. But, to start with, we're going to do a three-knuckle test. Julie, can you put your three knuckles in your mouth? And you can take it off now. And we'll also do a vertebral artery test. We'll ask her to scoot down or up towards me. Okay, her shoulders are off the table now. And then I'm going to rotate it to the side and ask her to count to 10 and ask her not to blink. Or 10 down.
So I start now.
Yeah.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay. And we'll do it on the other side as well.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay. All the while supporting her head, and now we're going to ask her to scoot back on the table.
Good.
Okay. And so we're going to start with the zygomatic arch, doing circular motions and working our way down to the mandibular. And then with the palm of our hands, we'll work on the temporalis as well. And then back to the zygomatic arch. You can work on this zygomatic arch for longer. We're just not doing the full length of the treatment for video purposes. And now we work on the occipitalis. And we'll ask Julie to swallow while palpating for tightness in her seabirds. And also before starting anything else, we'll just say that we've already worked on her back, shoulders, and neck, and her SCM especially. And then we'll do a little bit of traction from C7 and up, and work up this to the C verts as we're widening our elbow basement here. Up to the occipitalis. And we can ask Julie to swallow again. And then we can work on the ears in circles with our 2 fingers. We can also do a gliding motion here. And then with our palms, like we can work down the jaw and ask Julie to slowly open her mouth. And back. Open your mouth slowly, Julie. As we work our way down to the jaw and down. Okay, and now we go back to the neck and slightly turn her head to the side. And with one thumb beside her ear and 2 fingers here, we can make circular motions while with a slight traction on the neck, with both hands working. These 2 fingers on this side and the thumb on the other side. And then we do the other side. This is where your thumb is, while the other 2 fingers are working the other side. And then we can go back to the zygomatic arch with bigger circles. Since we have relaxed the muscles here, we can identify which side is tighter and work our way down to the jaw. Okay, can you open your mouth? Open. And close. And open. Okay, now we're working on the lateral pterygoid here. Pterygoid. We'll ask Julie with say a heavier pressure. We'll ask Julie to open her mouth again slowly. You can do some circles and compress. Close mouth. Okay, and we'll ask her to gently open her mouth again as we do circles and compressions. And close their mouth again. And then we'll ask Julie to scoot back off her head off the table. Okay, that's now. Yeah, while gently supporting her head. And then this time we'll be working on the hyoids. From the jaw, We'll be extending and flexing, putting some tension on her neck. And extending and putting more tension and working our way down. To her clavicle. And when we reach the subclavicular, we'll use the palm of our hands. We can do this again. We can slide our fingers as we extend and flex the neck. And again, subclavicular area, we use our palms. And then we do this bilaterally. Again. Okay, so now we'll ask Julie to scoot back on the table. As we do her ears and do a little pet massage. On her neck. And then we can go back to the ears, working on the inner lobe, but not really going inside. We're pulling it from all sides. Or we can also do circulars. And then the next step is we're going to her mouth, so we'll be changing gloves. Okay. Bracing your one arm on her clavicle here and supporting the head and clavicle. You can put, we'll ask Julie to open her mouth so we can go inside. Now we're working in and out, like our thumb in there is doing some rolling. As our fingers, 4 other fingers are also doing the work outside. And we can just roll the fingers. And then we can also go medial. And we're working both on the upper and the lower part of the mouth. Okay, close your mouth. And we can do more circles. We're working on the lower part now. And then we'll ask Julie to open her mouth and feel for the upper molar and feel for that muscle there. You can also feel for trigger points. And now that we're done on this side, we'll place our both thumbs at the bottom of her teeth with her open mouth, and then we'll ask her to try to close it at 10% effort, and we count to 10. 1, 2, 3. Okay, and relax. And then we'll ask, with our hands on her jaw, we'll ask her to open her mouth with 10% effort as we count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and relax. And you can do this like a couple of times. And then we'll try to relax our jaw with circular motions. And now we'll work on the other side. So please open your mouth. And we do the same thing. Our thumb is working on the inner side of the mouth, while the other fingers are working on the outside, like rolling or gliding to the medial. And looking for trigger points. Just as we've done to the other side. Okay. Again, we do the same thing. Place our thumb on her bottom teeth and ask her to close her mouth with a 10% effort as we count to 10. 5, 6, 7, 8, 9, 10. And then relax, relax. And then the opposite. Well, we have our palms on her jaw and ask her to open her mouth with 10% resistance. And again, counting 1 to 10. 6. And then we ask Julie to relax. And then we relax the jaw with circular motions. And that is our TMJ disorder treatment. We'll ask Julie again to do the 3 knuckle test and see if there's any improvement. The other hand, Julie, so the camera can see you.
I can't.
Is it wider now, right?
Mm-hmm.
Okay, thank you.